Ula Vinaka, this is Pacific Waves from RNZ Pacific. I'm Susana Suisuiki. Coming up, Papua New Guinea grey listed due to money laundering.
It's going to be difficult to draw investors' financial.
Meanwhile, the country grapples with high rates of ear infections among children and
I think most people here have said that actually we've relied too much on other people.
Pacific science experts urge to take the lead on regional issues. Fiji's president has urged the country's parliamentarians not to sow seeds of fear and division this election year. In his address for the state opening of Parliament this week, Ratu Nengama Lalambalavu said the election must be a contest of ideas and vision. Koroi Hawkins has more in the address, which covered a wide range of topics from unity and diversity to climate change and the threats posed by AI.
In a speech which mentioned the word unity 17 times, the president was at pains to underline factors which create division. He noted the threat of false information. On media and artificial intelligence, Ratu Nangama says today information is being disseminated at unprecedented speed, but with little regard for accuracy.
The misuse of artificial intelligence is an emerging threat that will have a detrimental effect on governance, national unity and peace. While freedom of expression remains the cornerstone of our democracy, it carries with it a grave responsibility.
He says Fiji's multicultural society is one of its greatest strengths, but unity does not arise automatically from diversity.
Unity must be consciously built through fair laws, inclusive policies, and respectful leadership, a shared commitment to the common good.
Ratu Nangama flagged the Truth and Reconciliation Commission process as important to fostering unity, inclusivity and mutual understanding across all communities.
The Commission's findings and recommendations should be approached with maturity, guiding practical measures that strengthen reconciliation, institutional learning and lasting social cohesion.
The President described climate change as the defining challenge of our time. Ratu Nangama says Fiji will continue to remain a global leader in climate advocacy while acting decisively at home.
Government's key priorities include the securing accessible and predictable and grant-based climate finance, the scaling of support for adaptation, and the operationalizing loss and damage arrangements.
Looking at the region, Ratu Nangama says Pacific nations are navigating complex geostrategic dynamics while striving to preserve peace, cooperation and their sovereignty. He reiterated the importance of the Ocean of Peace concept reinvigorated by Prime Minister Sitiveni Rabuka at last year's Pacific Foreign Leaders Summit.
That the Pacific should not be an arena for conflict, rivalry or militarization. Rather, the Pacific should remain a region defined by dialogue, cooperation and mutual respect.
As well as warning against sowing seeds of division, the President urged those running for public office and their supporters to uphold the integrity of elections during and after polling. He says democratic stability must be protected beyond polling day, warning that reckless behaviour and divisive rhetoric can undermine public confidence in elections.
I now declare the 2026 session of the Parliament of the Republic of Fiji open. Pinakawalewu, Taliapan. Thank you.
Papua New Guinea is under close watch for money laundering, running a risk of being abandoned by global investors. The G7-founded Financial Action Task Force have placed PNG on their grey list due to strategic deficiencies in government oversight. Experts say it highlights a risk in doing business with the island nation, especially for a neighbour like New Zealand. Kaya Selby has more.
Michael Kabuni is an anti-money laundering researcher at the Australian National University. The decision, he says, was only a matter of time.
There's been very low investigations, especially into what you call the politically exposed peasants, politicians, bureaucrats. Political interference, lack of independence of the anti-corruption agencies is a very big factor.
It's a bad signal for Papua New Guinea to send to the markets at a time when the country is pushing for investment, particularly in its LNG projects. One such project, the Exxon-backed Papua LNG near Port Moresby, faces an uncertain future despite its $13 billion price tag. As many as 30 banks are refusing to put cash in. Kabuni says it's likely the grey listing has a lot to do with this.
And now that Papua New Guinea has been grey listed, it's going to be difficult to draw investors' finances. So we'll never actually had an investor come in during the grey list period.
When the Financial Action Task Force places a country on its grey list, it pressures the government to address their failures in law enforcement and government oversight. Failing that, they face the blacklist, joining the likes of North Korea and Iran. For trading partners like New Zealand, doing business with Papua New Guinea may become inherently riskier and therefore more expensive.
A bank might have a New Zealand-based customer that it knows is trading with Papua New Guinea. The bank now has to take extra due diligence on those underlying transactions.
That's Kerry Grass, an investigator and anti-money laundering consultant based in Dunedin. She says that gaps in New Zealand legislation could expose the country to possible ill-gotten gains entering through unofficial channels.
In the ideal world, it should be a risk that is managed by ports across New Zealand. But I don't think, New Zealand is actually operating at a jurisdiction level where these controls or knowledge is actually down to that level.
Reeling from the reputational blow, Papua New Guinea's Prime Minister James Marape told local media that they would work their way out.
In time, possibly 1 or 2 years, and I have given all state agencies within 1 year to finalize on activities that needs to be done. The 8 or 9 points as observed that we must do.
But Mr. Kabuni says it's one thing to pass legislation, it's a whole other thing to deliver results.
Are these laws being implemented? Are there prosecutions? Are there confiscation of illicit proceeds? Are people being sent to jail? And Papua New Guinea has never been effective on that front.
It's not Papua New Guinea's first time on the grey list. They worked their way out in 2014, but it remains to be seen if they can do it again.
The first ever study to estimate the prevalence of otitis media in Papua New Guinea has revealed some of the world's highest rates of childhood middle ear disease. Published in the Lancet Regional Health Western Pacific, researchers found almost 75% of children aged 15 or under were suffering from OM, or middle ear infections, and this jumped to a staggering 86% for kids under 3 years. I spoke with Dr. Tamara Veselinovic, a clinical research fellow from the Kids Research Institute, Australia.
So the research that we did was in collaboration with the Papua New Guinea Institute of Medical Research, which is based in Goroka in the Eastern Highlands of PNG. And I work for the Kids Research Institute in Perth, Western Australia, and we have a kind of collaborative research agreement between the two institutions, and we've been doing a lot of research together for many years. And so the research that I did was looking at otitis media, which is ear infections, among the kids attending clinics in Goroka. And this was led by our PNG collaborators at the Institute of Medical Research. And so they went and did all of the field work, and we found really, really high rates of ear infections among the kids attending those clinics.
Yeah, why is there a high number of children suffering from middle ear infection within Goroka?
Well, we actually didn't know that the rates were going to be this high. This was the first kind of comprehensive study to look at ear disease in this population. Probable reasons why, the reasons that drive high rates of infections are quite common all around the world. And in PNG, they have a very high burden of infectious diseases in general, and ear infections are one of those. So high rates of colds and flus then drive high rates of ear disease. And, living standards are much poorer in PNG, and that's probably one of the reasons why we're seeing high rates of ear disease. Lots of kids as well living in smaller houses, crowded houses, potentially is driving that. They also have lower immunisation rates, which also drives higher rates of infectious diseases. So, yeah, our paper highlights lots of the risk factors that we found, but we definitely weren't expecting to see almost up to 85% of kids having some form of ear disease.
Would you say that the findings also highlights the gaps in healthcare within PNG, especially when it comes to children with ear infections?
Yeah, absolutely. So a lot of these kids were coming in because they were sick, so they either had coughing or respiratory illnesses. Some were sick, had stomach illnesses, things like that. And we were opportunistically checking their ears as well if they wanted to be part of the study. So routinely they wouldn't have had their ears checked because at the clinics they don't have the equipment. The nurses and the doctors don't have the equipment to check ears, particularly in the clinics that we were doing the study, which they're not too far away from the city centre, about an hour away, but the resources are definitely limited.
How would ear infections be treated usually?
So usually through antibiotics. So I guess step one is to identify that a child has an ear infection, which is a gap that we found because they weren't getting their ears checked. And then step two is to prescribe antibiotics if required. And then in our study, we found really high rates of runny ears. So that's basically when you have an ear infection and it gets quite bad that the eardrum pops and all of that fluid drains out. So it's a runny ear. And that can be very dangerous. It can cause really significant hearing loss for the kids as well. And that type of ear infection gets treated with drops, so antibiotics in like a drop form, which in the study we found it was really hard to source in PNG because of resource limitations. So, we were lucky to have been prepared in the study to have all of these treatments available, but in a lot of the clinics they don't have the treatments.
So before you guys had stepped in to do that study, how would parents normally treat their children's ears?
Good question. I think if a child was obviously complaining about sore ears, they can take their kids to the hospital or the local clinic, and depending on who was there and what equipment's available, they would be able to treat it if the treatment medication is available on the day, because there are a lot of shortages of medications in the country. But I think a lot of these kids, their parents don't know that they have an ear infection. It kind of, if they don't have some of the kids don't really have sore ears, but their ears are full of this like snotty fluid, and it's normalised. That's just kind of how it is. So if their parents don't know, then they don't get it treated.
Are middle ear infections prevalent in other Pacific countries?
Yes, so to our knowledge, so obviously I'm based in Australia, and a lot of the research that I've been doing is in Aboriginal and Torres Strait Islander populations, and we find between 50% to 80% of kids have ear disease early in life in Australia among Aboriginal and Torres Strait Islander kids, which is 2 to 3 times higher than non-Aboriginal kids. And then in countries such as New Zealand, there's a higher prevalence of ear infections among Maori and Pacifica kids compared to non. So what we found is, and what globally we see, is that First Nations populations have much higher rates of ear infections than the other kids.
Thank you so much for your time, Tamara. Last question, what's next? How will this research address the issue and hopefully bring those rates down in PNG?
Yeah, so this first study that was just been published was led by my colleague, Dr. Celestine Aho. She's the lead from the PNG Institute of Medical Research. And so we went over to PNG after the study finished, because when the study started, it was actually COVID. So our team we weren't able to go there to get it started, but we were there when it finished. And then we have just started a new study to look at the prevalence of ear infections in school-aged kids, so grade ones around Goroka, and to see whether that early life burden is really carrying through to the school years, which is when it's really important, because then if kids are starting school and they're unable to hear, they're unable to learn.
Cool.
So we're still finding out, we're still collecting that data, and the team is doing a fantastic job engaging with all the schools, and all of the school teachers and headmasters are very excited about the study.
The chair of the Pacific Academy of Sciences says it's time Pasifika experts take the lead on climate change, health, renewable energy and traditional knowledge in the region. The Academy's inaugural Congress is into its final day in Apia. Suana Aholele reports.
Samoa is hosting the 3-day event, bringing together scientists, policymakers, researchers and Indigenous academics. Sir Colin Tuikatonga, who is a newly inducted Fellow and Chairman of the Academy, says it's a first for a region facing the worst impacts of climate change.
And not through the fault of the people of the Pacific. In fact, they generate a very minimal amount of the harmful greenhouse gases, and yet they're the people that are most affected. People here were talking about villages and communities having to be relocated and leaving their urupa, their ancestors, behind, all of those sort of traumatic things. So it's wonderful to be with people who think the same and share the mahi, if you like, share the emotion and share the knowledge.
University of Auckland Pro Vice-Chancellor, Pacific Professor Jemima Tiatia Siao, a Foundation Fellow of the Academy, said in a statement,
Pacific-led science serves to centre our values, alofa, aroha, tautua, reciprocity and the integrity of the sacred space that connects us to all things, seen and unseen, the va. Ensuring Indigenous knowledge system stands alongside scientific methods and translates research into real, equitable outcomes for our peoples.
Sir Colin says it's time Pacifica experts take the lead on climate change, health, renewable energy and traditional knowledge in the Pacific Islands.
The theme of the Congress is harnessing Pacific knowledge. I think most people here have said that actually we've relied too much on the other people from outside the region telling us the problems, and it's time really we want to lead and control the narrative, do the research, share the information so that it is amplifying Pacific voices.
The conference wraps up in Apia on Wednesday.
That's Pacific Waves for today. For all episodes, head over to rnz.co.nz/Pacific. We're also on Spotify, Apple and iHeartRadio. From myself and the RNZ Pacific team, tō whā, sui hua.